Here at the Dallas Ear Institute, we have always thoroughly cleaned and disinfected our exam rooms, audio booths, and instruments. In light of the current COVID-19 pandemic, we want to assure all of our patients that we are taking every precaution by thoroughly disinfecting high contact surfaces in the exam rooms and instruments after every patient encounter. We provide all of our medical staff with personal protection equipment while they disinfect the exam rooms. We are disinfecting the exam chairs, Mayo stands, microscopes, and high contact surfaces such as door handles, drawers, and countertops. Virucidal wipes, bactericidal wipes, and disinfectant sprays are used. Our instruments are disinfected with enzymatic solution for 20 minutes and then placed into an autoclave at 270 degrees for 30 minutes. Our audiologists are also wearing personal protective equipment and ensuring that the rooms are being sanitized appropriately between patients. Single-use insert headphones are typically used. Disposable headphone covers are placed over headsets, and wires and bands are wiped with virus and bacteria killing wipes. Specula for otoscopes are disposed of following each patient. For our more vulnerable patients or patients who prefer to stay home, we will continue to provide care through telemedicine Monday through Friday, 8 a.m. to 2 p.m. Through these virtual visits, we can discuss many symptoms and determine treatment options.